this meeting. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good morning, everyone.
Good morning, Mr. Chair.
Approval of the county board minutes.
I'll make a motion to approve the report.
I'll second it.
I have a motion, a second. Those in favor?
Aye.
Opposed? Motion carried. Any additions or deletions?
Good.
I need a motion for additions and deletions.
I'll make that motion.
I got a second. Any more discussion? If not, those in favor?
Aye.
Opposed? Motion carried. Social services.
Good morning, Mr. Chair.
Good morning.
Commissioners. I have a couple of reports before an action item today. The first report is around children's mental health, and Melanie is a supervisor of children's mental health, and so she put together a report for the board on some of the activities and work that our unit is doing, so.
Good morning.
Good morning,
Morning.
Melanie.
Well, I have put together a report on children's mental health. As you recall, children's mental health is a voluntary service that Morrison County provides to our citizens for kids aged 0 to 21 that have a severe emotional disturbance. And that disturbance needs to be diagnosed by a mental health professional, and that establishes their eligibility. What we're really seeing is a range of severity of severely emotional kids that we serve within that continuum. And also with the increase that we're seeing in our numbers, we're also seeing an increase in the traumatic experiences that our kids have experienced in the community that contribute to those mental health needs. I do have a chart that shows our case management caseloads, which continue to grow. They kind of dropped a bit and then are coming back up. Lot of activity, a lot of referrals. I know we're very busy, but I'm also happy that we have the referrals because my years of experience here show me the importance of early intervention in mental health for children and the difference that can make for our community in the long term. So I'd rather see these kids referred to us and have us serve them than have those caseloads kind of not demonstrate what's really going on in the community because we know there's needs. The next slide shows our continuum of services for kids with mental health issues. The emotional disturbance part of the continuum is served by our community. Specifically, we have Northern Pines Mental Health Center that does school-based mental health, outpatient services from a variety of other providers, and Greater Minnesota does outpatient services for little kids at our TCC offices and connected with that group. And so that group of kids is connected and they don't need to access case management or the deeper end services, and they're served in those capacities. And sometimes those kids do not have all their needs met, and then they are referred to us and then further up the continuum of services, beginning with our case management services, and we access a respite care grant that our parents actually tell us is probably one of the most important services that they value that we offer. And that is supported by the state, but also our county board in supporting that as well. And the kids also tell us that that's significant for them. It helps them build coping skills. It gives parents and kids that break from each other and really helps us defer a lot of out-of-home placements. That has been my experience over the years. Kids also sometimes don't have all their needs met, and then we end up certifying them as disabled so we can open up other services in the medical assistance continuum for them, which is the family support grant. They may get a Min Choices assessment, may get some skilled nursing care to help with their medication. Sometimes some of our kids need to have, once they go through that Min Choices assessment, are determined to be eligible for the CADI waiver. And we have been, as you'll see in our slides, that we've been increasing that use of that service as a way to keep kids in our community and keep them in their families as well. And kids that are 16 and over that have significant needs that meet the criteria for residential treatment can be served as the Youth Act. I'm not going to remember what ACT is now.
Youth Assertive Treatment, Community Treatment.
Yes, thank you. And that is a special grant that only a few counties can have access to. Northern Pines is our provider for that grant. And so that is eligible for kids 16 and up. They're eligible for this intensive service in the home, which includes psychiatric care that will come to their home. So it's really unique. And we've, corrections and social services have made referrals there. Probably the only downfall of that is that they have to be on regular medical assistance and they have to be 16 or older. We've been asking the state for a number of years to move that down to 14, but I don't hear any movement on that. And then some kids then still have significant needs, and we do look at a 45-day assessment at residential or a residential stay for 6 to 9 months. And then we also have a number of kids served in caddy foster care, which is where they live in that home with 24-hour care and staffing services to meet those high behavioral mental health needs. The next slide shows that how much we have increased our use of caddy waiver case management and caddy waiver services from 2015 to 2019. The nice part about caddy is it's not only out-of-home placement, it also includes intensive services that can be provided in the child's home, which is independent living skills, and independent living skills, I think, is the most often used service, along with behavior analysis. And those are two very sought-after services that parents and kids find benefit from while living in their home. The next slide shows our mental health out-of-home placements for each setting, the different types of setting that we use. We really don't use group homes for mental health anymore. We haven't found that to be very helpful to treat mental health symptoms. So we'll use regular foster care, that very seldom, and then as you'll see in a later slide, most of that has to do with our state ward population that are residing in foster care. Residential treatment has remained pretty steady, even considering that we've had an increase in caseload. And then you can see the greatest increase over time has got to do with our caddy waiver foster care that we've experienced quite a bit of success in keeping our kids in our community and close to their family, but yet providing pretty intensive treatment. The next slide shows our children's mental health locations, so where the kids are at and their permanency status, because one of the things I really wanted to demonstrate to the board and what I've been seeing is that, yes, we have more kids in out-of-home placement and mental health that we're registering as that. It's important to recognize that a bunch of those kids coming into that system counted in the mental health numbers are also child protection and state ward kids. So they're not just kids living in the community with their families. So the first column represents the voluntary services, the traditional children's mental health, where there's an intact family that's seeking treatment and placement for their child. And as you can see, most often we use waiver foster care for those settings. And like I've mentioned, we've had really good success. We have a couple local homes that provide caddy foster care, and so those kids go home frequently to their families. But we've actually seen some improvement in the family relationship and connection because of that intensive intervention, but yet having a lot of contact and still feeling included in their family system instead of being so far away. The residential numbers are about the same, and those high foster care, regular foster care numbers those 5 are the state wards or child protection cases. So more than likely, you could say those kids are in those settings not because of their mental health and foster care, but because of the child protection or state ward situation. The next slide, again, I'm trying to illustrate and further define for myself as well as you how this works out within our numbers over time, the state ward and the voluntary intact families. So we are seeing an increase in voluntary placements as well for voluntary intact families, and I think that does have a lot to do with having that access to caddy foster care as well as that child protection state ward increase.
And I think this is a good area to continue to manage and monitor, just given the number of child protection cases we have and the trauma they've experienced. And we've seen with those kids who we've worked with longer, they are harder to place and harder to adopt. And so we end up working with them on within another area of our organization. And so to continue to monitor how many state wards we're working with on this side, I think is a good thing to manage.
One of the things we haven't, that I didn't define in this report that we might want to look at later is when a child is adopted and then they become my voluntary intact family numbers. And so I know we have a number of kids that we are serving in that system that were state wards that are adopted too, so we might want to look at that. I've always been cautious to treat those kids differently, but, maybe it's something for us to look at in the future. The next slide is about I'd like to do a differentiation of the budget, depending on, how this impacts our county tax dollars when we try to serve kids. Most of our kids are served at that first column, really. Moderate level case, and they have health care. So we provide quite a bit of service, in my opinion, and quite a bit of intervention for not very much, very cost efficient, very cost effective service. You can see the highest, of course, is those residential placement kids, those placements are high cost placement. They do all have health care because once they go into residential placement, they are eligible for MA, but MA doesn't really cover residential
No.
placement. So,
It covers a portion.
yes.
Melanie, Mr. Chair, is this per year per child?
Per year per child, thank you for clarifying that. Yes, so this is an example of one child on a yearly basis, or one family, one child, under each of these categories. This year I added CADI to this because we do have county expenses related to CADI foster care and those when they're in placement, but also you can see that it's substantially less because we have federal and state funds that we're accessing for those cases to help pay for that.
Those are generally the most
placement.
costly placements, CADI
Yes.
placements, but they're paid for through the waiver.
So I think, Mr. Chair, so often we talk about out-of-home placement. You hear that with colleagues across the state and the cost and the impact that it has to costs for county government. You can kind of see here illustrated what and why that means, what it does, and the work that we're doing to try to keep kids out of that column is huge. And so I know Mel and her group have done a tremendous job with that.
So for a high needs case, that would be significant mental health issues and needing significant intervention. And yet, with health care and without placement, providing for services within their home, that is so much more cost effective, if at all possible, even if we're paying and providing substantial respite care.
Yeah, exactly.
And it's just hard on kids in general. To go, particularly to residential treatment, I mean, we have to sometimes, but that usually is 2 to 3 hours away. They're going to a facility, they have no idea what it's like, who's there, and also the difficulty we have for that is transitioning those skills back home into another setting is really difficult because a lot of the kids have difficulty generalizing information because of their trauma that they've experienced, or maybe some fetal alcohol effects, or some, we have a number of kids born now that have, had their brains impacted by drug use. And so getting them to transition those skills home is really hard, and that's why we've seen more success with the CADI waiver placements. Health plan coverage, I always like to kind of keep an eye on this. So PMAP used to be our, what currently is South Country Health Alliance. So they are eligible for MA, but they have that health insurance provider that manages that care. Then we have straight medical assistance, and then we still have a pocket of persons with no insurance or have private insurance that really doesn't provide much for health care coverage.
So, Mr. Chair, if I may, Melanie, the individual does not have insurance.
The child may not have insurance, or the other parent may not have insurance. They
And-
may choose not to apply for insurance, and we can't.
Who's paying the bill? Is medical assistance not paying the bill? Who's paying the bill? If we have no insurance, and I see it clearly, 8%, no insurance, somebody's paying the bill.
Well, it depends on what services they're using. If they're just using case management, then that's taxpayer dollars for the
Okay.
staff. If they're going to Northern Pines Mental Health Center, they have a sliding fee scale, so they would then be paying their own bill at Northern Pines Mental Health Center. A lot of times, depending upon what services they're using, will be dependent upon the cost.
So just because we don't have any insurance doesn't mean that the vendor's not getting paid, because I'm obviously the person that's paying that vendor because I'm not on medical assistance and don't qualify, whatever the case is. That's correct?
The client may pay or the county may pay, depending on the situation. And, you know, I will approve some of those costs sometimes for us to pay. If I look at the situation, I understand what the difficulty is with the healthcare. And then if we have a plan to get them on and we just can't get there yet, but we want to start providing some services so we don't end up in a child protection or out-of-home placement, I'll approve that. But we usually do that with a kind of a plan in mind.
Okay.
And moving forward instead of just kind of open-end checkbook kind of thing
Sure.
going on.
Thank you.
Thank you.
Yeah,
Cost-benefit analysis.
I get it.
Yes.
Thank you.
all right. The next slide shows our target case management rates, and that is impacted by a number of things. We're getting better as a staff in learning about how to improve those rates and working on that consistently. Only a certain amount is within our control, because now I know we're way over on our cases again, and I think that might drive down some of that rate next year. We'll have to just see how that goes. But that gives you an idea of where we're at with that, staying at a pretty good level. And that's important when we look at the next slide, which is our total income for children's mental health. You'll see that targeted case management through a health plan, or the PMAP, is about twice what we get for medical assistance with less clients on it, and that's because we get 100% of that TCM rate, that dollar amount per month, that $531 per month when we're working with a child. Medical assistance, the state keeps half of that. That's why that number is different. That combined mental health grant up at the top, that is shared with the adult unit, but that does also help fund and cover the costs of some of those cases that don't have insurance and that we can't build targeted case management on. I don't think it comes close to really, but at least they throw a little bit at us. And then I have spelled out our caddy that we get for case management time. That's just case management. That's not to cover the placements. That's just what we bill in case management. We have a respite care grant and a screening grant as well. So those are all income that we use to support the mental health continuum of services for our kids. So really, you know, I think I've kind of talked about this a little bit, the benefits of children's mental health. I really do believe in children's mental health and early intervention. My experience has taught me that for sure, what I've seen through the years. The relationship that our case managers make with the children and the family make a real difference. I have really good, committed staff. They're very interested in their families and providing good service, so I feel very fortunate with that. We try to divert, you know, placements, child protection, and ongoing adult mental health issues and crisis, suicides, and increase their social skills and their functioning in the community. And that's really our goal, is that these kids will probably stay in our community, and we want them to be as healthy and as functioning and contributing member as possible, and that's our goal. The challenges, again, for children's mental health is just the lack of services available for kids, in contrast to you know, for example, the adult continuum is just staggering. It's hard to get enough providers in our community. There's long wait lists. Psychiatric care continues to be a problem. And so although people recognize the benefit of it, it's really hard to get enough providers here, and really in all parts of the state.
And it really is a workforce issue too. You know, Northern
Yes.
Pines has a number of openings. And to get staff who want to work in homes is very difficult these days, and especially some of the hours when you work with kids and families, it's very difficult.
Yep, it has to be evening hours, and we know that in-home is very effective to work with kids and families, but yeah, getting providers that are talented and willing to do that is tough. You know, and then as Brad mentioned, we do have a number of kids that have experienced trauma related to child protection issues and foster care. And probably the greatest number we've ever seen as a result of what you probably heard recently at the Child Protection Out-of-Home Placement Report. And so that, of course, we work as a team within the agency and for our community. And so we do our best to support those kids as well in the mental health side. And sometimes we do provide dual case management. That is what we provide, children's mental health case management alongside child protection or state ward case management, so that those individual needs in mental health really are served well. The last slide, I just want to inform you really quickly about some new initiatives I'm pretty excited about. We have worked on a trauma-informed social history for all the kids, and the children's mental health staff are using that, and that has been nice because that allows their story to be told without having the child have to retell it over and over again. And so that has been helpful. We're also a part of the innovation zone at DHS, which is, we have a goal to increase positive family connections and community connections for all of our kids. And so as a part of that, we're doing a training, and we're trying to get kids and their families as well as other people engaged, because we see that the more connections kids have, the more healthy for the long term they are. And then we did get awarded a Big Idea grant from DHS under the Cell First Aid, the Extended Foster Care Youth Program. And that really dovetails with the Innovation Zone, which is developing that informal support network. Really want our kids, as they, like I said, want being in the community and to be a productive citizen, they have to have these connections with others and not just service providers, because service providers come and go. And helping them learn their skills from each other and their family is essential to that. And then we have a youth board that we're going to be developing that will help us inform some of the services that the youth can tell us are most helpful to them, rather than us telling them what we think is helpful.
So as excited as Melanie was to get this grant, it's now the reality of
Yeah.
having to implement the grant. So she did a great job in writing it and was kind of surprised to be awarded the grant. But I think if we can create that vision of a youth board where they will have some input into how we support and help our youth and families, it should make us a better organization.
Gentlemen, any questions, comments?
Thank you for all the great work that you do. These numbers are great.
Thank you.
Yeah, it is, again, I'm just amazed, the information that you give us, but again, what goes into this children mental health is just unbelievable. And the county and your staff, Melanie and Brad, do a great job.
Thank you
So-
very much.
Mr. Chair, if I may, when, Melanie, early on, you referred to people being referred. I think I know the answer to this question. Who refers?
School social workers, doctors, outpatient therapists, the school-based mental health. Also, families can just walk in and ask for services too and see if their child qualifies, and we do have some of that as well. We do get referrals also from other parts of the system, which would be the child protection unit as well.
So then at what age, generally speaking, if there's such a thing that you can do that to, I don't know. What is the earliest age that we're talking about we're involved?
I think the youngest case we have, which is just recently, would be about 2 years old. And that referral, because Greater Minnesota, for example, is at TCC and provides the mental health services in that setting. And then Northern Pines also has other early child mental health providers. So if they are working with a kiddo that they see meets that SED criteria, because it's a very specialized evaluation they have to do, they will make that referral, and that's why we have some of those referrals right now.
So then we deal with ages anywhere from 2 to, I'm anticipating 18, or is it 21?
It's 21,
It's
yep.
21.
So,
And then a lot of times we'll transition them into adult mental health as well, depending upon if they meet the serious and persistent diagnosis. With kids, the level of diagnosis isn't as high as for adult mental health, so we could be working with them, and then we have to close at 21.
Okay.
Yes, usually what we're doing in those situations is we try to refer them to a community mental health provider, like the adult mental health rehabilitative services are called ARMS, which is a step down from adult case management. We try to bridge that, but there are times when kids are like, yeah, thanks, I'm ready. And that's good too, you know, that they are feeling like they can do this without formalized services.
Fantastic, thank you very much.
Thank you very much.
Thank you.
Appreciate it.
Thanks.
I'll ask Karen and Cindy to come up. So since they did all the talking a couple weeks ago at planning, they said they weren't gonna talk today, but they might have a word or two to say.
Good morning, Karen, good morning,
Good
Cindy.
morning.
As you might recall, Karen and Cindy brought this forward to planning a couple weeks ago. We've had conversation with our funeral homes about the burial policy. We are required under Minnesota statute 261.035 to provide burial services for those who cannot afford them. So if an individual passes away and they do not have the resources necessary to bury themselves, or the family doesn't have the resources necessary, because sometimes we do actually just get a call from a funeral home and they don't even have family. But they will then come in and do an application, and then we are required to determine if they're eligible for burial services. As a result, it's an appealable application, and so we're required to have board approval for our burial policy. So we made some changes to the burial policy. We did increase the amount by a little bit for each earth burial and cremation. However, what we're doing differently is we are not going to pay them per service, but we're going to pay them a lump sum. We're going to require them to have an immediate earth burial or an immediate cremation, which reduces the cost to the funeral homes for managing the individual and their burial needs. Funeral homes as you know, as you can see, for earth burial, it's $3,400, and for those of you that have buried a loved one, it's much more costly than that. And so trying to be reasonable versus prudent with the tax dollars. And so that's what we're bringing forth today, is a request to approve this burial policy beginning January 1st of 2020.
Gentlemen, any questions, comments?
Mr. Chair, first of all, I'll make a motion.
I have a motion. I need a second for more discussion.
I'll second it.
All right. I have a question for you. Again, we probably brought this up, but if you could remind me. The maximum for county to pay for a burial is $3,400. And I know whatever it was last time, but if I can't afford it, or my family can't afford it, but, so then you have a maximum, the county would pay $2,500. Is that family required to have a cremation because the fact that you can't, you're not gonna be able to pay for the burial? Is that in the statute? Yes, no, maybe?
Yes, there are some counties that actually only pay for cremation, but if they don't have a cemetery site, then we would require a cremation. So family could go out and buy a grave site to have them buried. Otherwise, it would be an immediate cremation, but I know some counties have just moved to immediate cremation, or the family takes care of the burial. We are offering both at this point, so.
Mr. Chair?
Commissioner Wilson.
I think in this discussion too with them is the funeral home now, let's say I wanted to pay some money towards a funeral. The funeral home can allow that now, right? They can still get their assistance here, but if I wanted to pay as somebody else, wanted to help pay for something to give them a little better funeral, I could do that, and they can accept that, is that right?
Correct, that's a good point, Commissioner, is that our current burial policy does not allow the family, if they have the means, to improve the process of funerals. So we are allowing that in this new policy, and I think the other important addition to this is that if a family sets up a GoFundMe account, that's now taken into consideration under our current policy. We weren't able to take that into consideration without adding that. And we know GoFundMe accounts are now much more prominent for when bad things happen. And so that's the other addition that we had to this burial policy. So thank you.
And the dollar amount, or I should say the state requires counties to pay for a burial, correct?
Correct.
So it's, because it was brought to my attention that why are we paying, not the state? But I'm assuming, the county has 1 to 50. If we have different counties, they probably have 50 to 500. So I think that's answers my own question.
One other point I might make, and I just lost it, so I see Commissioner Jelinski might have a question, so.
Mr. Chair, if I may. Brad, and I don't know if you have the answer to this. I've talked to several different funeral homes in recent days, weeks, months, and the question has been that they wanted to have this conversation.
Correct.
My question is when was the last time, if we know the answer, and I don't know that we do, when was the last time we actually had this conversation with funeral homes to where this is an increase, this is a decrease, that they actually got funding from the county, and the county said, well, this is it, whatever the number is, and now the county's coming up with this number and saying this is it. Are the funeral homes, through your meetings with them, saying, yep, this is finally, it's taken 25 years, but we finally have an increase in something?
Well, we actually did meet with them in June or July or August. We met with the two funeral homes locally to develop this policy. We did not put as much into the final amounts as they might have liked. We did share this with them prior to planning and invited them to come into planning as well, if they wanted to come in and talk about it. I don't know if they knew we were bringing this for approval today, but we did ask for comments from them, and we did not receive any from them. And I remembered the point I was gonna make as well. So when we're working with individuals, especially in long-term care, under medical assistance, if we're working with a family and trying to approve medical assistance, especially for the older folks, one of the things you can do with your assets is create a burial policy or create a burial account. So on the financial assistance side, we will talk with families about that. So hopefully they would have a burial account set up if they're coming in to apply for MA, because a lot of these folks will be on MA that may require burial. Or if we're working with individuals who are disabled, older individuals who are disabled, and they get assets, we will work with setting them up a burial account as well. So planning for their future.
So Brad, so
hopefully-
medical assistance, MA requires a burial? Can you explain that?
It doesn't require it, but if you have extra assets that disqualify you from MA, so let's say you have an extra $10,000 in the bank, which then disqualifies you from MA. So what we will say to them, if you put that $10,000 into a burial account, then we don't count that as an asset, and that would qualify them for medical assistance, especially for those going into nursing home or long-term care facilities.
And if I may, we don't dictate how much they can put into that. So of that 10,000, if they choose to put in 3,000, they're still able to keep 3,000. They would have another 4,000 left that they would have to spend down in some other acceptable way.
And then you mentioned, so when you're in nursing care, you're allowed to say maybe if they don't have no income, they have nothing in the bank, but they get maybe $500 a month in Social Security. Some of that money they can use themselves, not all of it. So is that what you're trying to do, is say, okay, out of the 500, 300 goes to the nursing home, 200, and can you want to start putting 100 away for your burial? Is that kind of how that works?
Well, initially, when they're applying for the medical assistance, is
Right.
what Brad was referring to with being over assets. So that's where that would come in. They have to have $3,000 or less to qualify. So if they exceed that 3,000, we then require that they spend it down and get the value for their money. They can't give it away, they can't buy jewelry, things like that. But what you're speaking to is, yes, if they receive Social Security monthly, they are only allowed to keep the personal needs allowance of $99 a month. Anything else that they receive goes to the nursing home, and then MA picks up the balance after that. So some clients, have a great work history and maybe have some pension money. So they might be contributing $5,000 a month, and then the county's paying the additional, could be up to another $5,000, $6,000. But it really can save the county money.
So they can't, if they're getting $500 and they don't have no assets, none whatsoever, and they're getting $500 just in Social Security, they get to keep 100 of it? They can't put 100 of it towards their burial?
No.
Okay, all right.
So, Mr. Chair, if I may, back to my original question. When was the last time, does anybody know, that we had this conversation with funeral homes?
I believe it was 2010, the last time they had an increase. 12?
12.
Okay, sorry.
Very good, thank you. That's what I was
Commissioner
looking
Blaine?
Thank you, Mr. Chair. I'm trying to go back through my notes here, but maybe you can help us. Annual cost to funeral and burial, let's say over the last 3 years, is equivalent to about what? To the cost to the county?
Well, in 2016, the yearly total was $31,362. In 17, it was $24,838. In 2018, it jumped to $56,869. And when I ran this, these numbers, it was back on September 26th. At that time for this year, we were at $40,215. And I believe, Karen can help me, but I believe we're over $50,000 at this point in the year. And part of that, of course, is, as I've preached many times to you, the baby boomers. As we get older and we're dying, there's more people, and that's where the extra dollars are going.
This has been one of those areas, again, that ebbs and flows because we're required to pay, and we never quite know how many people might qualify.
Thank you.
So from a fiscal perspective, though, we're looking at, this is about a $50,000 cost to the county.
Give or
Right-
take.
Right
take.
now,
Yeah.
right now.
Yeah.
Okay, very good, thank you.
To follow up on Commissioner Blaine's question, do you have it separated out how many are burial versus, let's say in 2007, how many are chosen one way or the other?
Cremation versus
Yeah,
burial?
Right.
I don't believe we do it.
We've not broken them out that way, no.
I'm not kind of on the fence for, having if somebody can't afford nothing, then why we would pay more. That, I am having a hard time swallowing that, the cremation. And I know there's religion involved in this and that, but still, if the county's picking up the tab, I'm having a hard time digesting that, why, have them do a cremation,
I
so.
believe statute dictates that we can't force them.
Well, if they don't have a grave site, they have to go to cremation.
So, but if they have a grave site, then they go to a burial, we'd have no say-so. Is that what you're saying?
Yep, that's
Okay.
what our policy would indicate, yes.
Because I'm thinking, I'm not there, but don't people who get cremated also go in grave sites?
Not all.
Oh, yeah? Okay, well.
A lot of people have them on their mantles.
Okay. All right, we won't
And,
go
and,
there.
and again, Mr. Chair, it is a balancing act between being respectful of an individual and their wishes and what the family wants versus managing the taxpayer dollars, so we certainly understand that. But we felt like this was the way to kind of manage all of that and give funeral homes the ability to manage this without us having to micromanage what they're doing with families and loved ones.
In the future, I would kind of like to see what the breakdown is, how many are cremation versus burial. If everybody's going to the burial, well, that's because, there's more cost here, but. Anyway, gentlemen, any more questions
I
or
do.
comments?
I know that the county pays this. Are we reimbursed through state or federal money for any of that?
Only if they are on MFIP, Minnesota Family Investment Program. We are reimbursed if they're on that program.
The only
Or
other thing I would,
I'm sorry, I was just gonna say, or possibly, if we have a lien on property or whatever, depending on how much they've already spent being in a facility, if there's monies left over, we can recover for burial as well.
and the only other thing I would say is in our complicated funding scheme, we do get about 13 or 15% back because of our cost pool and other associated things, because we always get a little bit of reimbursement based on our cost pool, so.
Commissioner Blaine?
I just want to say, the third party involved with this that's not here, that, is the funeral provider, the funeral home, and the morticians that are actually doing the work. And so I appreciate staff's initiative in working with them to bring forward you know, a respectful proposal here that I think meets the needs and we recognize the cost, but there is also a respect factor there, and not just for the families and for the deceased, but also for the people doing the work. We're not here to expect that funeral homes do this for nothing. So I appreciate your work. Thank
Commissioner
you.
Wilson.
And I think another big win for the funeral homes on this is that if there's some other party out there that wants to pay for part of the services to upgrade, now they can do that. Before they couldn't do that. Am I correct?
Correct.
Okay. So,
And my last comment would be, I'm assuming the funeral homes also are required to take these senior, or whoever passed away. They just can't say, no, we don't want to take them, right? Okay. All right, gentlemen, any more concerns, questions, comments? I have a motion and a second. Those in favor?
Aye.
Opposed? Motion carried.
Thank you.
Thank you.
Thank you.
Thank you,
Nice
Thank you very
discussion,
much.
everyone.
And then I have a contract for approval. This is a contract with Resource Training and Solutions of St. Cloud for guardianship services. Guardianship services are, again, a service we have to provide. So for those who are unable to care for themselves, we may have a guardian. We spend about $30,000 a year on guardianship services, so this is a new provider. Bless you. What I would say is that Resource Training Center is a sister organization to Sourcewell, so this to some degree is a shared services agreement with this organization, and Sourcewell helped us develop this relationship. So as part of this contract, they're gonna help us in Region 5 create more of a unified guardianship approach, because we worry that it's a pretty significant legal action to take guardianship of an adult. It takes away all their rights and their abilities. It doesn't mean we're gonna be able to control or manage them, and some people think that's what does happen, but it does not. So, but they're gonna help us kind of organize and create a guardianship screening team, work with our courts and our families on guardianship. So in the end, we're hoping it might reduce the number of guardians that come through the court system. And I would also say that this is actually a per person per month amount. So we don't have to manage how many hours they're spending with the individual, where all of our other contracts are hourly, anywhere from $40 to $55 an hour. And the other reason we need this contract is we are losing a guardianship provider, so they're actually gonna transition from one provider to this provider right off the bat. So I would look for a motion to approve this contract, and then I would be able to sign it.
Gentlemen, I'll ask for a motion and a second.
So moved, Mr.
I have a
Chair.
motion, I need a second.
I'll second it.
Any more discussion?
Mr. Chair,
Commissioner Zelinski?
this doesn't center just specifically on Morrison County.
Correct. This is, we as the 5 directors in Region 5 worked with this organization to create this contract. And I did have Brian Mindorf, our county attorney, review it as well. But we worked together on this contract because they're gonna work with all 5 of us on this partnership.
And when we're talking about the individuals, we're talking about, again, the ages of 1 to 101.
18
Thank
to
you.
101.
18 to 101.
120,
Okay.
depending on how long they might live.
Exactly,
but,
exactly.
Yes, this is only for adults.
Okay, very good. Thank you.
If we're working with kids, they become a state ward, and then we work with them.
Commissioner Wilson?
Sourcewell is one of 9 service co-ops, and this is one of the other co-ops that
Correct.
does a real good job at that. That's why we don't reinvent the wheel, we just use their services to do this.
Yep. Yep, so they're actually working with a couple other counties besides us in Region 5, so.
Should I abstain from this?
Any more discussion? If not, I have a motion and a second. Those in favor?
Aye.
Opposed? Motion carried.
And then if I could just update you on one thing, you all might have received an email from AMC yesterday from Julie Ring indicating that the Department of Human Services is actually going to send us a bill for the overpayments for the chemical dependency services that we talked about at planning last week. And AMC is suggesting that no counties pay for that bill, so I've talked with our accountant and we're not going to pay that bill. It sounds like we're going to work on some legislative action over the next session. And so whether or not we have to send a letter or just not pay at this point is yet to be seen, but if we need to send a letter, I would send a letter, also indicating we're not gonna pay until there's more of a resolution. So AMC was looking to all the counties to kind of align with this issue and this frustration on this overpayment. So I just want to give the board an update, and as I said, you might have received an email from Julie Ring yesterday on that particular issue.
Commissioner Blaine.
So I'm assuming that AMC was present yesterday at the legislative hearing for the Department of Human Services, where their new director testified yesterday on the issue of this overpayment to counties and amongst the other things that are going on there that we won't get into today because we don't have a whole week.
Where that new director was kind of held to get the job done.
Yeah, it was actually a 90-day update, and I'm certain AMC was in the audience. I don't know if they took other comments or not, but I'm certain they were in the audience.
So Brad, have we taken a heartbeat of like what the other counties are gonna do? Some may pay, or do you think most of them are gonna be?
I think I'm pretty certain most counties will not pay, if any, until there's a better resolution. And you might recall our cost was about $95,000 and change.
All
So-
right,
The saga will continue. I
Yes.
can almost guarantee it.
Correct.
all
All
right,
right,
thanks
that's
a
all I
lot,
have.
Brad.
Thank you. Have a good day.
Thank you,
Sheriff,
Brad.
And while the sheriff's coming up, I forgot at the beginning of the meeting, we have a state champion amongst us for Pierce Pioneers, so I have to put that out there, congratulate them for the football team. Actually, I watched the game. They have no defense, either one of the teams did. Up and down, just
Yep,
run,
it
run,
was
run.
it was a tough game,
It's a
but they
good game. Yep.
they came out ahead. It was good.
I'm happy for Pierce and for
Yeah.
Morrison County. Great
They did a
representation.
Wonderful job, absolutely.
All right.
I thought somebody told me they lost.
Yep.
I thought somebody told me they lost.
I don't have one.
Yes, they do.
I don't think it's in the packet. Yeah.
Medical exam contract, is this one you have?
I didn't watch it.
We have that in
play
the-
or anything.
Oh, no, we just got it as a resolution or a approval or an action or whatever.
Who did they beat?
Typically, those things are in the packet. That's what you normally would have. You just handed him. Oh, he just handed you one.
All right. No, that's what we should be able to do, is be able to scan it.
Good morning, Sheriff.
Good morning.
She's done that before.
Working on
We're
our
just gonna
administrative
pass
stuff.
it on for a
Absolutely.
second.
Get there.
And I see you gave it to somebody that can get the job done. Thank you.
Delegate. So, good morning, everybody.
Good morning, Sheriff.
So, yeah, in front of you, you'll have like the Midwest Medical Examiner's Office contract. And as we discussed at our last planning board meeting, we were going to switch from Ramsey County Medical Examiner's Office to Midwest Medical Examiner's Office in Anoka. One of the reasons I stated at the planning meeting for doing so was every year we like to do some comparison checks as far as prices, where we're at. And of course, we're up for renewal on our current contract through Ramsey County Medical Examiner's Office. However, I was informed by Dr. McGee, who is the lead medical examiner for Ramsey County, that he was stepping down. He was going to help out in the transition process, but he'll no longer be the lead director there. So we thought it was a good time just to kind of look around, see what some other options are. Again, we looked at Midwest Medical Examiner's Office in Anoka. We did a trip, the chief deputy and I. We toured their facility. We met with their lead medical examiner, their building administrator, as well as one of their investigators there. And as far as apples to apples, we're very impressed with their facility. The fees, as far as the autopsy, are similar. However, their administrative fees with Midwest Medical Examiner's Office is a little bit cheaper. And the big thing is we pay out for our deputies to do a lot of these transports once someone dies and an autopsy is required. So we're paying out a lot of overtime, and of course, Anoka is gonna be a lot closer than the haul down to Ramsey County. The biggest thing is, at the planning board meeting, I think we talked a little bit about the contract. I just finalized it because before there was, every county does things differently. So we wanted a one-year contract versus a multi-year contract. So that's the switch that you'll see in front of you, the change that was made under the term. Otherwise, the language has been reviewed by our county attorney, and it's been approved. And I'll answer any questions if you guys have any.
Gentlemen,
Mr. Chair, the only question that I would have, if I'm reading this correctly, upon at least 3 months of written notice specifying the termination date given by either party with or without cause, that would break the contract?
Correct.
That's, okay, very good.
Or
Thank
a mutual written agreement.
you. Yep, exactly, thank you. That's all I was looking at.
there's no other questions or comments. Would you be able to read the resolution for us that you have in front of you? Do you have that or not? We have a resolution, appointment of medical examiner. For the record, please.
Sure. So it's Resolution 2019 Appointment of Medical Examiner, whereas pursuant to Minnesota Statute 390.005 provides that the county board may appoint a medical examiner for a period not to exceed 1 year. And whereas Morrison County has contracted with Anoka County for autopsy services for 2020, and whereas Dr. Quinn Strobel of the Midwest Medical Examiner's Office in Anoka County is qualified under Minnesota Statute 390.005 to serve as a medical examiner. Whereas Dr. Quinn Strobel was appointed as medical examiner for Morrison County for a period January 1, 2020 through December 31st, 2020. Now therefore be it resolved that Dr. Quinn Strobel is appointed medical examiner for Morrison County effective January 1st, 2020 through December 31st, 2020.
Thank you for that, Sheriff. I need a motion. and a
Mr.
second.
Chair, I'll move on this.
I need a second.
Second.
I'll give that one, Commissioner Blaine. Any more discussion? If not, those in favor?
Aye.
Opposed? Motion carried.
Thank you.
Thank you, Sheriff.
Thank you, Sheriff.
Absolutely.
Okey-dokey. I see Land Services is here. Come on down. I have to think.
Addison, it's good to see you,
Thank you.
and I hope you know what I'm referring to.
Amy, it's good to see you too.
I'm just glad that, no, you know what I'm talking about.
Yes, I do.
I'm just glad that you're A-okay. And of course, it's good to see you too.
Thank you. No, we're all happy to see you.
Yes, I
Addison.
think we are. I know we are. Thank you.
Addison's got something to hand out to you, and then we'll get started.
Look at that.
And we won't discuss why we're so thankful Addison's here.
Yeah.
Thank you. Thanks, Eddie.
All right.
There are reasons for this too.
Oh, okay.
Good.
Good morning.
Good morning.
We have in front of you today the MPCA County Feedlot Program Delegation Agreement Work Plan for 2020 and 2021. This is really an annual agreement that we enter into. We do have a delegated feedlot agreement with the MPCA, so we essentially administer the state feedlot rules on behalf of the MPCA, and this is really just kind of our work plan as to how we're going to achieve compliance with Minnesota Rules 7020. We have to put forth a work plan as far as how are we gonna go about this work, and we have concentrated on kind of hot topics, I guess, in the past. Nitrates being one of them, and then also some of the smaller feedlots that have never seen inspection. And I think one of the results of merging with the assessor's office is looking at approach to work. And Addison really was like, why are we not taking a quintile approach to the feedlots? Why are we not putting this on a rotation where we are systematically looking at every feedlot on a 5-year rotation? And we were like, great idea. So that's what Addison is proposing to get us on, and that's what she's proposed to the MPCA. So I will let her go through that with you.
Thank you for the introduction. Okay, yeah, so the sheet that I handed out to you guys is kind of a preliminary, and it's a 10-year rotation because we have so many feedlots in the county.
And just one person.
And one person. I can do a lot, but not that much. So it's generally, I tried to keep it around 60 feedlot inspections each year, and then breaking it out by township. And honestly, kind of just randomly, it's not like I start in the north part of the county and work my way down. It's kind of just how they fit together to bring me close to 60 feedlot inspections in a year. And yeah, Amy kind of talked about the reason for doing this is in our previous delegation agreements, we would have some work goals, as in like inspecting feedlots that have never been inspected before. Well, the only way I know if they've never been inspected before is if I pull their file out of my 3 file cabinets full of feedlot files and then page through to see if they've ever been inspected before. So this way, we can say at the, once we get to 2030, that we've been on site at every feedlot in the county. And also with new feedlots that are being built and constructed, I'm going out on site and looking at those right off the bat, so we can already say that someone was out there making sure that everything was in compliance right away. So this is kind of more just a way to capture some of those feedlots that have maybe been registered since like, the 70s or 80s or, those earlier dates that no one has ever been to. And so going forward, we can say that we've been to every feedlot.
If I may, when you go out and do these inspections, if there's a complaint about Elmdale, let's use an example, and you're in 2020, so then that's part of you have to go out there and inspect that one if you have somebody say, hey, they're doing this or whatever.
Yeah, so if I say for 2020, like you were saying, if I am doing Belle Prairie, Granite, and Richardson, but I get a complaint about a feedlot in a different township, I'll still go out and do, those inspections in other townships too. So if we get complaints or new construction too, I'll be reaching out of those townships that
So you don't give up doing one in Belle Prairie because you have to go look at the one in.
No, I could still just tack that on to the inspections that I'm doing.
What's your definition of a feedlot?
It's 50 animal units or more in agriculture zoning and 10 animal units or more in shoreland zoning.
So a hog barn or a chicken barn, that's a tier 1, is that considered a feedlot?
Yep.
Okay.
Yes.
So this will be every registered feedlot, so every feedlot that has 50 animal units or more in the ag zoning district.
And I
10
knew
or
that, I
more.
just want to get it for record, what a consider
Just
feedlot.
wanted to test her.
Test
In
her. Oh, no,
those-
I didn't have to test her.
Still
I just-
sharp.
Well, in those inspections that she does related to complaints and all that, that's really in addition to the systematic inspections that is part of her work plan. So that really is built in and goes with the territory for the feedlot officer, that she not only does that baseline number of inspections that we're required to do by the state, but it's also following up on complaints and new construction.
And so if you do an over-the-counter permit for a tier 1 barn, that's still inspected underneath this.
Correct.
A year down the road or 5 years, it'll
Yep.
still be, so to make sure they have the right buffer and all that good stuff.
Yep.
Okay.
Yes, and any conditional use permit that we're issuing, if there's conditions assigned to
Right,
that's a whole separate workflow that
Right.
goes into a queue for follow-up if there's deadlines on those. So that work also happens alongside this inspection work.
Mr. Chair,
Commissioner Jelinski.
I have to ask the question because it's driving me a little bit on the crazy side. If I have 50 animal units, be it what it might be, I don't care if it's chickens and cows and sheep and 50 animal units, do I just automatically know that I have a feedlot? Do I just know that?
Not everyone knows, so a lot of times I'm catching a lot of when people come in for building permits and they want a 3-sided cattle shelter or something like that. Or you can see on aerial imagery that they maybe have some lot conditions. I've been catching a lot that way, like just kind of saying like, hey, how many animals do you have out there? And I've had honestly 4 or 5 this year that I've added to our feedlot registrations because they are over 50 animal units and had no idea that they needed to be registered. So not everyone knows that. Trying to kind of get the word out there and make sure that people know that when they're supposed to register. So we've kind of been, so for example, I've created some brochures about feedlots in Morrison County, at what point you need to be registered, and kind of some outreach like that. So we're trying to kind of get the word out there.
Beautiful, thank you.
Yeah.
How much work is involved in an inspection? I mean, I know you go out, you take a look. Is there a week's worth of paperwork, or to fill out forms and stuff of what you did, or?
It kind of depends. Every inspection's a little different. If I go out to a chicken barn and they've got a stacking slab, everything's under roof, they've got all their land application records, it's pretty easy. You know, you go in, you don't even have to really get out of the car, you can just drive around because we don't enter the barns for biosecurity reasons. And that maybe would take me like a couple hours, just fill out the compliance inspection checklist, send that to them with a compliance notice, and then I'm done with it, basically. Well, and then I do have to enter that information into Tempo, which is MPCA's database. But
Yeah, the most time-consuming part of that is going through their records, is really making sure that they have the paperwork that they're supposed to have when you have a total confinement barn like that. So that's, more time is spent there than actually walking around the feedlot itself for something like that.
yeah, and if I have a feedlot inspection that comes back as non-compliant, it can take a while, you know, depending on the deadlines that we're giving them, and that's more paperwork we have to go through, and you know, maybe several site visits as well that I have to follow up on and make sure that everything is up to snuff. So it really depends on each feedlot.
Sounds good, thank you.
And Mr. Chair, if I may, Addison, you've been at this for a while, and I get it. And I also get the fact that not everybody has wonderful records. In your history so far, are you finding that, yes, people are starting to dot a lot more I's and cross a lot more T's, or do we still have a lot of, I'm not doing it anyway?
Well, so that's kind of part of the reason I wanted to do this kind of systematic approach too, because a lot of those farms I'm going to are maybe smaller scale, where they just cross over that threshold where now they need to start keeping records. Or maybe in the past, the feedlot officer never told them they needed to keep records when they pulled the permit over the counter. So I'd say we're still having issues with land application record keeping. It's definitely still an issue, but like with our especially our larger farms going through that CUP process, and you know, we're making sure that they're have enough acreage and they're keeping those records, and that going forward they know they need to continue keeping those records. I'm hoping that down the road we'll see that overall improve.
One of the things that Addison has put together too is when we're dealing, or when we're working with a producer that is going through a tier change or establishing, she now has a packet that goes to that property owner with really all of the record-keeping sheets that they need to have, and explanations for this and that, and the state law on that and that. And so it's just really a nice bundle of information that they have, where it can be kept in one spot, and it really goes over what their responsibilities are. And then after the first of the year, we will recap for you 2019, and also continue with our awards of excellence for our outstanding feedlot producers for 2019. So we'll recap that for you after the first of the year.
So Addison, on the feedlot inspections, do you do the manure management under them too, or that's totally separate?
Yeah, so if a feedlot is over 300 animal units, they need to have a manure management plan on file. And then if they're over 100 animal units, but not quite to that 300 animal unit threshold, they need land application records, which is essentially the same information, but a little less in depth.
Because I've had farmers say, well, yeah, Joe Blow, he uses my farm, but I haven't had manure here for 2 or 3 years, or, you know, or somebody's doubled up on there. So that would be under that program, and I think we're kind of getting to that now in our system, where it's gonna be a lot more easily.
Yeah, we're starting to map that now, so as these manure management plans come in, now we're mapping the acreage. So at a glance, we can see what fields have been claimed for manure, and so then we can look to see if we've got some double counting going on, and or reconcile that with other manure management plans.
Gentlemen, any more discussion? Any more?
Mr. Chair, if I may.
Explain.
Our conversation spawns a couple questions here. So, number one, the 50 animal units, you said that's the county.
That's the state threshold.
But yes, and so I wanted to clarify that the state of Minnesota sets that in statute, that that any facility with 50 animal units must register as a feedlot, correct?
Yes.
Okay, so in this ongoing effort here, as a governmental unit interact with our residents, process. So when we look at in 2020, we're going to look at Belle Prairie, Granite, and Richardson Township. So we recognize right now there's 60 feedlots in those three townships. Do you make appointments with those owners of those feedlots to go and visit them?
Yeah, so I sent about a week or two in advance, I'll send them a letter with the day and time, and then just asking them if that day and time does not work for them to contact me and we can reschedule. I try to definitely work around people's schedules because I realize not everyone is full-time on the farm too.
And so, Mr. Chair, if I may, in relationship to the comment by Commissioner Jelinski, in the sense of someone that has maybe has just met that 50 animal unit threshold, now will be recognized as a feedlot in Minnesota, and looking at that pertinent paperwork, I'll say, that these people need to track, have, whatever. Do you make that list available, or do you make that information available to those producers before you go to visit them, that, by law, you are required to have this information, so that these producers, when we go to see these producers, they're not caught off guard? It puts us in a good light that we want to work with those producers out there and have things registered, I guess you would say.
Yeah, so in my letter that I send them, when I, give them the inspection notice, I do have a section in there that says feedlots over 100 animal units need to be keeping land application records, and I will review those on site. And then feedlots over 300 animal units need a manure management plan on file that I will review on site. So I do kind of give them that notice in there, and sometimes I do have people call ahead of time to just see, what all I'm looking for, to make sure that they have everything I need.
Yep.
And then for those feedlots who have maybe just met that 50 animal unit threshold, they technically don't need to be keeping records until they reach 100 animal units. So I may mention to them, if you're planning on expanding, you need to start keeping these records at this point. But if they are not required at that time, then I don't usually cover that with them.
So help me here then. If we're going to make an inspection at a 50 animal unit feedlot, then we're gonna recognize they have 52 animal units there. So we're gonna go see them, but there isn't any technical information that they have to track. Is that correct?
As far as land application records, there's nothing that they need to be tracking.
So when you go to see a feedlot that has 52 animal units, and there isn't a trigger out there that says, I need to keep records of this, this, and this, what are we going out there to look at?
So in those cases, I'm usually going out to look at open lots to see if there's any lot runoff. And then also mortality disposal. Are they, rendering, burying, composting? Is that all properly being taken care of? Feed storage. If it's a dairy, how are they dealing with the milk house waste? Those sort of things.
Mm-hmm.
So there's still other on-site things that I'm assessing when I do feedlot inspections in addition to that paperwork.
Excellent. Thank you.
Mm-hmm.
I appreciate your response.
Gentlemen, anything else? I just had a question, looking at your 2020 grant award feedlot, there you show 612, I totaled these up, we have 584, so that's what must be permits that are coming due in 2020? Is that why it states 612 feedlot numbers for 2020 versus 584? Just.
Is there the discrepancy between
Yes.
what we have?
Yep.
So the MPCA, what they have on record for what we have for registered feedlots does not match the county, and that's because our information is updated a lot quicker than the MPCA's, because theirs takes first I send the registrations into
Lag
them,
time
and then
there.
they send it back to me.
Better
And,
job, that's all.
right, yes. Let's highlight that.
All right, that answers that.
Much better, that's right.
All right. Anything else, gentlemen? This is not a motion or anything, it's just informative, so.
So this is really just, we're gonna ask for signature by the chair for this agreement, so I'll be handing that over for signature, and then this will be delivered to the MPCA.
But it's a great thing that you did here, Edison. I like that rotation.
I would propose that we vote on it as when you're signing something, that you accept it and enter it.
All right, gentlemen, I'll ask for a motion and a second to approve the MPCA County FELAT Program Delegation.
Mr. Chair, I'll make that motion.
All right, I have a motion, I need a second. I have a second. Any more discussion? If not, those in favor?
Aye.
Opposed? Motion carried.
Thank you, Addison.
Thank you. And I just have one other item for you. And this is to consider the interim use permit, and then also the amended conditional use permit for Autumn Antlers. This is to establish a limited rural business, specifically an event venue out there. This was recommended for approval by the Planning Commission with one condition to the interim use permit, and that is that the interim use permit shall terminate when a transition of ownership of the Autumn Antlers, Inc. property occurs. And then also, then the second condition would be an amendment to the 2006 and the 2010 conditional use permits for outdoor recreation to include
Gentlemen, I'll ask for a motion, a
parcels.
second with the two conditions.
So move, Mr. Chair.
I have a motion, I need a second.
I'll second it.
Any more discussion? Not those in favor?
Aye.
Opposed? Motion carried.
All right, that's all I have for you.
Thank you, Amy.
Thank you, Amy.
All right, moving on, we've got auditors report. Chelsea, good morning.
Morning, Chelsea.
Morning, everyone. First on the agenda here I have today, I'm requesting approval for the large assembly license for Ice Fest to be held on January 11th and 12th, 2020. Hours will be 10 a.m. to 6 p.m. And the dates are subject to change if weather is not permitting on the current date set. As we spoke in planning session, Chuck will notify the Sheriff's Department 1 week prior to the event on how the ice situation is.
Gentlemen, I'll ask for a motion and a second.
I'll make a motion.
I have a motion, I need a second.
I'll second it.
Any more discussion? Again, this was brought forward last week. It was a great discussion with, I was not gonna say Mud Fest, but with
Chuck.
Ice Fest, you know, so again, I think it's, yeah, there we go. And, so again, nice discussion. I think it's a good thing for the county, and, we can move on there. So gentlemen, I have a motion and a second. Any more discussion?
Mr. Chair, we just ask one question.
Sure.
I don't exactly know who's in charge of how thick the ice is, but Sheriff, you would work with Ice Fest, if you will, in regards to how thick or how deep, how thick the ice would be, I'm to assume? And I apologize, you weren't up in front here, but.
It's probably my fault. Oh, boy. Good thing this isn't being taped. Yeah, I think what we're gonna do is he'll check the ice 1 week prior. We're gonna make sure there's a minimum of 12 solid inches of ice.
Very good. Thank you very much.
Any more discussion? Not those in favor?
Aye.
Opposed? Motion carried.
Thank you. Thank you.
Thanks, John.
Next on the agenda, I have a request for approval of the delinquent manufactured home tax resolution.
Great, that's a great discussion we had last week on this one, too. So gentlemen, I'll ask for a motion and a second.
Mr. Chair, I'll move on
I have
this.
a motion, I need a second.
I'll second.
Any more discussion? Not, those in favor?
Aye.
Aye.
Opposed? Motion carried.
Next on the agenda, I am requesting the approval to write off the 2009 delinquent manufactured home tax penalty and interest. This is the report that we went over heavily at planning session.
I'll move on that,
I
Mr.
have a
Chair.
motion, I need a second.
Second.
Any more discussion? If not, those in favor?
Aye.
Opposed? Motion carried.
Next, I have a resolution, and this resolution is requesting approval for the exempt permit application from Mary Lord School to hold a raffle on January 24th, 2020 at the Falls Ballroom.
Gentlemen, I'll ask for a motion and a second.
Mr. Chair, I'll move this.
I have a motion, I need a second.
I'll second it.
All right, any more discussion?
Mr. Chair, if I could just have Chelsea, this is a little bit different format. Do you want to explain to the board why we're seeing it this way? You and I talked about it, but.
Sure. I spoke with the gambling unit with the state in regards to the gambling permits that we receive. And how the process works is we receive the application in the auditor's office, and it's brought forward to the board to be approved. And then we send it back to the application individual. And on some of the applications, they request minutes, or they could request a resolution number. What we have been doing is attaching the minutes for the application, but sometimes now with the state, they're requesting the approved minutes. So from the time that we get the application to the time that it gets in front of board, and then for the approved minutes 2 weeks later, it can be a 6-week process and a 6-week leg. And so having resolutions in front of you, we can then get a resolution number approved at the board meeting, and then I can put that resolution number on the application, and the state is fine with that. Every resolution will have to state who the application, or who is bringing forward the application, where the location is, along with the address and the city, what dates, and what type of gambling they will be doing. So this format of this resolution covers all of that information.
Any more discussion? I have a motion and a second. Those in favor?
Aye.
Opposed? Motion carried.
Thanks, Chelsea. Just one small change that you realize, comes.
It is, yes.
It's impactful, so I appreciate you looking into it and doing that way.
And last but not least, I request approval for board warrants.
Mr.
Motion and a
Chair,
second.
Mr. Chair, I'll make a motion to approve
This will be a
everything,
roll
all the
call,
bills.
yep. And I need a second.
I'll second it.
I have a second. Any more discussion? Commissioner Wilson?
Aye.
Commissioner Blaine? Commissioner Zelinski?
Aye.
Myself is aye. Motion carried.
Thank you.
Thank you.
Thank you, Chelsea.
Public Works? Morning, Steve.
Good morning, Steve.
Good morning, Mr. Chairman, members of the board, ladies.
Morning, Steve. Thanks for that.
I have for your consideration today a revised organizational chart for Public Works. As the board is aware, we've been working on this for several months. We've had considerable discussion at our Public Works planning meetings relative to this. I, although not inclusive, had listed some of the things that over time have been changing with Public Works, and that I have a desire to make a more linear organizational structure in the department instead of more of the pyramid structure that we currently have, in order to provide those managers with more of a streamlined ability to conduct their work and to be able to pick up that workload and that additional responsibilities for the things that have been changing over quite a long period of time with Public Works without having to add any additional staff. So when you think about the Clean Water Act and the involvement with that, and there's always seems to be funding on the one side with the MPCA and implementing and doing the things that they have to do to make sure there's compliance, but there isn't a lot of consideration for all the agencies and everyone that has to do the work within those agencies to do that compliance. It's always on the top end that's getting pushed down. That's one of the things that's happened there, where you look at all the management practices and the design that goes into place for stormwater pollution prevention plans and those type of things that are being implemented on projects across the county that we deal with. We have a much more active role in public ditches than we've had in the past. When you look at Sioux Line Trail and Belle Prairie Park becoming regional facilities and the efforts that we have put in place so that we can make those facilities eligible for funding sources that we've never seen before. All of those things have, result in a desire to try to streamline how we are organized at Public Works so we can accomplish these things without additional labor. So the organizational structure, if you look at that, it's more linear. The assistant engineer and the construction engineer looking to make those equivalent positions. One is dealing with the contractors and utilities and the work in the field, where the other one will do more of the preliminary design and the permitting and those type of things that will become year-round efforts so that we can keep our projects on track. The maintenance superintendent picks up the public ditch work that construction activity that's taking place in the field, and monitoring and dealing with those property owners who want to add that to that position. It fits because he's out in the field, he's around the county, he knows that drainage better than anyone else within the department. Our operations manager, when you look at how we track all our revenues and expenditures, we are a large department with just 2 folks that are dealing with that. So that, I think that really provides us with a better streamlining the way that is conducted when there's not as much reporting and requests for approvals to do the work that they're doing, and they know what they're doing. And then our environmental and rec manager, as we're looking to do the enforcement end that Public Works deals with in terms of the solid waste ordinance, the rec trail ordinance, noxious weed control, those type of things are going to be placed under that position. And also then as we move forward with trying to obtain outside revenue sources, that work will fall under that position. And so we're looking to do those five positions. There's a net 3-grade change across that entire board with the adoption of this. We have budgeted those expenditures within our 2020 budget. And so with that, I would propose, Mr. Chairman, for your discussion, and if I can answer any of
Gentlemen,
your
I'll ask for a
questions.
motion and a second and for more discussion.
I'm going to move on this, Mr. Chair.
Motion, I need a second. Second. I have a motion and a second. Any more discussion?
Mr. Chair, if I could just interject from an HR perspective and what we do with the organization changes such as this. So from the outset, when Steve and I spoke, he worked on updating job descriptions. And then we work with an outside consulting agency to take a look at job descriptions and do quite an in-depth study of what changes they make, because not only are we responsible as a public organization to be able to report to the state to ensure pay equity compliance is met, but we also have an internal structure that we want to make sure the integrity of that system is adhered to. And so we send that off so a very unbiased set of eyes can take a look at our jobs and where they fit within the organization. And so that was done over the last number of months. That's not a quick process, but there's a lot of work put into it, a lot of thought put into it when it comes to looking at how we do business and how we can best move business forward. And we know that things have changed over time. So I appreciate Steve's willingness to be able to look at where we're at and to respond accordingly. So we have an organization structure that meets the needs of the staff and the public that we serve. So just wanted to give you kind of a heads up on how that works.
Thanks for that, Deb. Any more discussion, gentlemen?
Mr. Chair, if I may, we've looked at this and we talked about this at our Public Works Planning meeting, and I appreciate what Deb says in relationship to communication with Steve on this, but I look at this, there's a couple things about this that to me are pretty striking. Number one, when we look at the business of the county, probably one of the, outside of maybe or arguably maybe the sheriff, the next most visible face for Morrison County is Public Works. Are people out there taking care of the roads, especially with that snow event and things like this, but construction, not just of the roads, as Steve says, parks, trails, public ditches. I think I don't want to understate the importance of the work that goes on in this department, because it becomes more visible to the public than a lot of other departments within county government. And I appreciate that, and I appreciate when I think back to the information that was given to us earlier this year about the number of employees that we have, the staff, the workforce that in Public Works, and that we're holding that number relatively flat for a number of years, and that's a really lean machine out there that gets a lot of work done in a highly effective way. And when you look at a reorganizational chart like this that is very linear, what that tells us is that leadership on the top is empowering individuals within his organization to do more and to utilize their talents, and he believes in those people to do those things and get the results. And when this works best is when you have great leadership at the top, and I'm very confident and very comfortable with this reorganization for those 2 points, because not only has Steve proven to be a superior leader of that department, but he has done an exceptional job in empowering his people from top to bottom to do their job, and they do their job. And so I feel very strongly about this, and I thank you, Steve, for your work and the work of all your people over there too at Public Works.
Thank you, Commissioner.
Any
Mr.
more
Chair?
discussion? Commissioner Zelinski.
I couldn't have said that better if it would have came out of my mouth. Thank you, Commissioner Blaine.
All right. Anything else, gentlemen? If not, I have a motion and a second. If there's no more discussion, those in favor?
Aye.
Aye.
Opposed? Motion carried.
Thank you very
Chair,
much.
we'll be implementing that according to our class and comp plan, getting ready for the.
Thank you, Steve.
Thanks, Steve.
Thank you all. We started off with a bang here. I just wanted to touch base with our snow event, kind of the worst-case scenario, I guess, with the long holiday, and it was equivalent to 3 major storms, really, is what the result of it was. With we were under our normal hours on Wednesday, so typically when we go out on a regular workday, the cost of that is additional cost of that is not bad, because either we're running that equipment or we're running other equipment. We have all the labor costs. There is materials costs that is a little bit higher, but even if we're doing other activities, there's oftentimes material costs associated with that. So if we are out on a regular day that in the department, it's usually not that big of a cost. But when you hit then the holidays, so we went out Wednesday with that initial blast. We did have a few trucks out Thursday morning on Thanksgiving Day, just to some of the icy intersections, that kind of things needed to be cleaned up. But then on Saturday and on Sunday, those were big events, and we were out long hours and used a lot of material because we had so much snow to make sure we weren't getting things bonded to the road and we were going to be able to clean them up. So it was a relatively expensive event because it was almost all overtime and a lot of material went out. So hopefully we're going to have a break here for a while so that we stay within our budget for the year.
Mr. Chair, Steve, did you ran a long time on Saturday? Or on
Yes.
Sunday?
Yes, both days they ran
Yeah, you were out in
12
like-
to 14 hours.
Yep.
Well, again, I don't have to explain this to Steve, but it was an SC snow. It was like rain and sleet, and it was such a heavy, and I think it was just like paste when I got on the darn road. So, but again, the roads are very nice, so.
Mr. Chair.
Fantastic job.
Steve, when you say that was expensive, if I'm not mistaken, about 4 or 5 years ago, when the roads weren't plowed, and I'll never forget the class you gave us on the conditions and temperature and things. I think, if I'm not mistaken, when roads weren't plowed immediately back then, that it took almost a month to get the snow off the roads. So we had to take road graders out and blade them because you said the trucks don't have down pressure, and that was absolutely terrible.
Those decisions that the maintenance superintendent, that maintenance foreman make during this event, you know, if they pull the equipment off too soon, or if they're not applying chemical correctly, that is what results where we're out there scraping. And you can take a storm, and although it looks like it's expensive, you can triple the cost because you're chasing and pounding after it with all that equipment, all that labor to clean it up when temperatures fall. And normally what happens, you get that snow event, it's in the, you know, high 20s somewhere where you can get it off. If you don't get it off in that window, then temperatures drop, it freezes on, it bonds tremendously, difficult to get off, and the effort you have to put into it is exponential compared to if you do it right. So the decisions they make can cost a lot, and we've got good people doing this work.
And myself, I was an idiot. I had to go to see Santa on Saturday with the grandkids, and I was out in this, but you could just tell, you come from Morrison, you go to another county. I mean, you guys do a tremendous job, you know. so-
Outstanding.
You've done well. Thank you very much.
All right, thanks, Steve.
Thank you,
Have a good
Steve.
day.
All right, Deb, administrators report.
All right, I have a few action items, and my building and maintenance friends are coming to join me here. But first, I have a contract for the Morrison County Public Defender System, the CHIPS. Scott Wunderlich does service for us, and on an annual basis, we have a contract to approve. Each contract runs 2 years. One's for the conflict contract. This is for the public defender system, like I said, CHIPS service cases. The cost did go up, similar to what our general increases have been, 2-year for the 2% for the first year, 3% for the second. And the per hour rate did go from $80 to $100. Scott did give me some information in that it's still a low rate in comparison to what he's seen elsewhere. So we're able to contract those services at a decent price, and I appreciate that. So I'd ask for approval for that.
Gentlemen, I need a motion and a second for more discussion.
I'll move on this, Mr. Chair.
I have a motion, I need a second.
Second?
I have a second. Any more discussion?
Mr. Chair, this is something that we've obviously seen before. One attorney that deals on all of this for Morrison County on a contracted basis. Mr. Wunderlich has done obviously a good enough job dealing with all of this through our social services programs, our law enforcement programs, and I fully support it.
All right, any more discussion? Not those in favor?
Aye.
Opposed? Motion carried.
All right, the next action item, and I know John and Mike are on their way. Well, actually, the next action item doesn't have John and Mike. So the approval of the tentative agreement with AFSCME Social Services Unit for 2020 through 2022. As you know, we had most of our labor agreements are ending in 2019, and so we've been working on getting those approved and moving forward. Social Services came to a tentative agreement, and that was approved by the bargaining unit, and so now I'm asking you to do that.
Gentlemen, I'll ask for a motion and a second for more discussion.
So moved.
Second.
I have a motion to approve the AFSCME Social Services Unit. Any more discussion, gentlemen? If not, those in favor?
Aye.
Opposed? Motion carried.
We have only one labor unit left, and that would be the LELS dispatch unit. We do have a tentative agreement with them. A very short meeting. It went very well. So this has progressed quite nicely. They are taking that to a vote with their group soon. I haven't heard that that's happened yet, but then I will bring that to you to complete this whole process. Again, it went well. I think we have staff that really are good at coming to the table and recognizing that it's a give and take negotiations is, and so you as a board have supported that too, so I appreciate that. I've done that work myself, and it's gone smoothly and for no additional cost, and it's been nice. So thank you for supporting that.
Mr. Chair, if I can comment on that. Ms. Gruber has truly done the county an unbelievable service. The fact of life is that if we were to contract out with an attorney to do this, which the county has in the past for years, I don't know what that cost is, but that cost, quite honestly, is astronomical, and there's no need. in today's world, my opinion, in today's world, we need to converse. And that's where Ms. Gruber comes in. It's through conversation that you can get this stuff done. It's not we're better than the other people, or they're better than we are, and go in there and have this fight every time that you have negotiations. There's simply no need for that. It's realistic. I get the idea of being covered by a union. I understand that, and that's life. That's the way it is. So I just want to say thank you very much. Good job.
You're welcome. All right, then I have some change order requests that we've talked about in building committee. Just to recap again, remember we had, one of our significant goals that we had when we entered into this project so long ago, was that we didn't want to increase a tax levy. And so we knew we had, with the bond issue coming off our books, we knew we had so many dollars to work with. The initial estimates, when we looked at our complex as a whole, came in much higher than those dollars that we had to work with. And so we scaled back that project scope in order to make sure our bids came back reasonably in terms of what we could afford. The bids came back good. We had good bids that came back, so there was some dollars there. And so we looked at prioritizing what we had taken out of the project, things that made sense, things that while we're in ceilings and in walls and looking at things, what was it that we took off of the project that really, now that we have the dollars, ought to be done, so we don't have to go in those walls and those ceilings sooner than we'd want to. And so in order to make those decisions, or make those priorities, or put those priorities in place, we've talked and ran those through a building committee. And so the four that we have right now are PR 53, which is the sheriff's office. The scope of the sheriff's office work when it comes to our mechanical systems, again, was one that we looked at it and said, you know what, this work makes sense. If we want to set up this complex in this building really for another couple of decades, and put systems in place that will get us through this was a recommended move. That does involve dispatch temporarily relocating, which I'm sure you can imagine all of the systems that they use. That's not an easy task, but we've got a plan in place. PR 55 does some work upstairs on floor 2 with the county attorney's office, trying to improve and, well, greatly improving their security and taking a look at their front desk and making sure that that's secure in a fashion that helps. Looking at their space, getting updates to some of their furniture and addressing that. Also the court admin security area, bringing all staff back behind secure doors was a goal for that. And then updating some of the carpeting that's been worn out after decades of use. Lighting updates are put in place, the third one. That's any area of the facility that we didn't remodel, still has then the old lighting. And so the idea is to update that, get the rebates, get everything up to speed on where we're at with lighting. And then we are looking at our parking lot. That was on the capital plan in the near future, to look at that. The construction of that is quite, well, it's been repaired and repaired and repaired. And so the engineering for that will be able to give us a scope on that work and allow us to be able to get bids to see if that's something that we want to do under the terms of this project also. So those are the four. Mike and John are here. They certainly know much more about all this than I do, but.
Gentlemen, I would ask if you want to put all four of these on one motion, or do you want to do them separately?
Oh, one.
It's all the same project.
Well, but again, I'm just putting this out there, maybe one of us or two of us, you don't want to do the projects, I don't know, but we can put them all together.
You know, I'm fine with having them as a package.
Okay.
We vetted this.
Me too.
We vetted this at, you know, at the building committee meeting. We can certainly, you know, gentlemen are here at the table. If we, you know, if we want to hammer them some more about things, you know.
All right.
Dig deeper into the wall here, now's our chance.
Okay,
But
all right. Gentlemen, I would ask for a motion to approve the order request for the four changes. I need a motion and a second.
I'll make a motion.
I need a second, please.
I'll second it.
All right, any more discussion? If not, those in favor?
Aye.
Opposed? Motion carried.
Really, we don't have any questions for Mike and John.
Well,
You know, I'll just ask a question. I think after.
Now
this
you do.
Well, after this project was done, if I'm not mistaken, don't we still have about $1.6 million in reserve at the bottom of that page or something? One of those or not? Am I thinking wrong?
Yeah, well, we still have money left in that, in reserve, correct. Yes, about,
1.1, I thought.
Okay,
In our
yeah,
building.
1.65, yeah,
okay, that's.
Of the bond you're talking about.
of the
No,
bond.
well,
Yes.
as of right now, yeah.
As of
As
right
of
now,
right now.
yes, correct.
Otherwise, hey, I hate to have you come here and not have any questions, but again, you guys had a good discussion last week at the building meeting, so I think you answered all our questions there, so.
They really
Good.
like it when I answer all the like HVAC questions and
Right.
stuff,
Yeah.
and the plumbing stuff.
Have
I like
traveling
listening to that,
expenses
Jeff. You did a good
retreat.
You did a good job.
Well, you know what, if we want, if we want
Blueprints and have her
to,
do
who
some
gets to
blueprint
pick out the
reading.
carpet? That's what I would like to know.
Who gets to, it's already done.
You made note of the fact that you will look at the lighting update rebates that should be available through Minnesota Power.
Yep, and we've done that
was-
throughout the project, and we'll
Yep,
continue.
and
Yes.
I'm happy, that makes me happy, so, otherwise, you guys are awesome.
Thank you, gentlemen. Sorry
Thank
about
you.
there's not a
Fantastic.
big
Thank
here
you.
question and answer thing. All right. Anything else, Deb?
I do have a resolution that I'm going to add, once you're done with the
Committee reports?
committee reports for closed session to talk about, litigation, pending litigation.
So if I may kind of get off subject before we get to committee reports, are we gonna have a new, press over?
New reporter, Mr. Chair, new
You the one
reporter.
to replacing Tyler? Well, welcome aboard. And your name is? Amanda. So we'll see if we can remember that or.
Amanda Rosinski? Very good, nice to meet you, Amanda.
Glad to have you, thank you.
Thank you. All right, committee reports. Let's start with Commissioner Blaine. And what's the dates, Tabitha?
Yeah, we gotta give me some dates.
December 8th through the 21st.
8th through the 21st.
Mr. Chair, while you're looking at these, I do have the agenda printed out for each of you for the AMC conference next week. I know many of you are attending numerous points in time, but I thought that might be helpful, so Tabitha
Yeah,
printed
that'd
those
work.
out.
Thank you.
And then also, if you're going to the South Country dinner on Monday night, you need to RSVP or let me know if
So
you,
if we're not, do we just don't RSVP or we just?
correct. I just didn't know if anybody was planning to attend. We could certainly let them know.
All
It's
right,
on
we'll let
Monday
you-
night, not Sunday night.
We'll let you know
All right, thanks.
today, yep. All right, so it looks like from the 8th to the 21st, gentlemen. Commissioner Blaine, what do you have for us?
So we are not meeting, we are not having a planning meeting next week, that is correct?
Because of AMC, right?
We are on Thursday
We are on Thursday.
at 8:30.
Oh, yeah. Thank you.
Yep.
As I look ahead. So, for me on Tuesday, December 10th, I have a double header with Amy Kowalczyk and Land Services. We're meeting with Elmdale Township at 6:30 and Swanville Township at 8:30, both on the same evening. There's a department head meeting on Wednesday, the 11th.
That was actually canceled because of AMC, so we won't have one.
Okay, so there won't be,
No public.
there won't be that. I was gonna say we have truth and taxation, but that's not correct.
What do you mean?
We do.
Yeah, 6:30 we have that.
Is that?
Wednesday night, yep.
6:30 on the 11th. Right?
Yep, I have down the 11th unless it's been changed since the last couple hours.
30,
Truth and taxation.
And that's here at the board
truth and
meeting.
taxation.
You're in the boardroom.
On Thursday, the 12th, I have the annual meeting at 5:00 PM for Region 5 and North Central Economic Development Association at the Luminary
See you,
Firm.
Terry, thanks for coming.
See ya.
Thank you.
Nice to meet you.
We have the planning session, yes, on the 12th at 8:30. On the 16th, excuse me, on the 17th, we have county board meeting at 9 AM. And I have.
Finishing up
on-
schedules.
On Wednesday, December 18th, Morrison Todd Wadena Community Health Board meeting at 3 o'clock in Staples at Sourcewell.
Did you say on the 12th you have a Region 5 annual meeting at 5 PM?
Yes.
And where was the location for that, you said?
The Luminary Fern,
Okay.
which is,
What city is that?
Where is that? What town?
that is 1561 Northern Pacific Road in Brainerd. I think it's in the old railroad yard. In fact, I know it is. I've been there for a wedding,
Okay.
so.
Anything else, Commissioner Blaine?
You know what, other than that, I think I can,
Keep your pen ready to write some stuff down.
yeah. I think I
Commissioner
will.
Wilson?
I've got on the 11th, there's a meeting in Genola over the highway, that one by the sales barn. I don't know what time that is. I gotta check with Steve. I
He said
know
it was
that
5 to 7, and I just told him, that's truth and taxation, so we'll figure that out. Because both him and you would normally be there, so.
Okay, so we'll see what happens
is.
there. Otherwise, I'm having surgery on my knee on the 13th, so I'll be out for a couple weeks after that, so I don't have nothing.
So we won't see you till after the first of the year?
I don't know, you might see me at the end, I might hobble in for the last meeting or
Oh,
something.
yeah, we'll push it in. Commissioner Zelinski?
Starting on the 8th, I'll be leaving for AMC. On the 9th, I'll be at AMC. At 8 o'clock that morning, I've got a public safety meeting. On the 10th, I'll be at AMC. On the 11th, I'll be at AMC. On the 12th, at noon, there's a public health staff potluck on the 12th,
What's the time?
12 noon, sorry.
Public health?
Public health, 12 noon on the 12th. Same date at 6 o'clock, I've got a trails meeting that I believe is in, I'm not positive if it's in Pillager or if it's at Sullivan Town Hall, wherever that might be, or Sullivan Town Hall or something like that.
Sylvan?
Yeah, in Crow Wing County.
Yep.
Not exactly sure. On the 13th at 10 o'clock in the morning, there's an armor rack meeting in Alexandria. On the 14th, Sprout is once again going to be active at the Crestliner Complex. On the 17th, at 11 o'clock in the morning, it starts, I believe, the holiday gathering at the Falls Ballroom. March training, okay. On the 18th, at 10 o'clock in the morning, I've got an Emergency Services Board meeting, Executive Committee, followed by the full board. And then at 5 o'clock that evening, I've got a Hands of Hope meeting, and I think that's in Todd County. On the 19th at 10 o'clock in the morning, I've got an Armor Owners and Operators meeting at 10. And at 7:30 that evening, I've got an Egg Society meeting,
7 or 7:30?
7:30. Unless it's changed. And I believe that's everything that I have, Mr. Chair. Thank you.
Thank you. And again, I don't know, I have down here, on the 17th, we have a public notice meeting during or after the board meeting for that EAW.
During, I
I
believe.
think that was during.
Yep.
I think that was during.
Okay, so, but again, that'll be here. So, and then I'll have TCC at 5:30 on Thursday the 19th. And due to the holidays, we move soil and water to 9 o'clock on the 20th of Friday. Otherwise, you got me covered.
Tabitha, I'm mistaken. It is 7 o'clock.
Okay.
Anything else?
I have a question. The public safety on the 9th, you weren't gonna go to that. You did mention it, but you're gonna be at AMC?
I'm sorry. I shouldn't have said that. That's part of AMC.
Oh, got it.
I'm sorry.
It's It's your AMC.
Everything
Yeah.
is down there.
Got it, got it.
I'm sorry.
Because I have the extension down there, no, yeah, so, but.
I shouldn't have even
We just
said that.
advertise the conference as a whole,
Yeah,
knowing you'll be
I-
there.
sorry.
Okay, so do we make a motion just to
Do you have
open?
a question on one of those? No? Okay. No, the resolution that I have is, Morrison County is involved in litigation in the following case. It's Kevin and Pat Casella versus Morrison County. And the case file was in the resolution that Brian just handed me, which, where did I set it? I have the case file and it'll be on record.
Okay, so,
Yep, and so the typical resolution where we, have hired counsel, our counsel is here to give us an
all
update.
right, so I'll make a motion, or I need a motion just to close I have a motion, and then we'll close it at 10:50. We'll give a few minutes to shut the,
Greg seconded.